Okay, so we are into the pharmacokinetic aspect of drug pharmacology, and the important, first of all, important factor, that is absorption. So, okay, pharmacokinetic is mainly divided into four categories, as we have already been seen, and the major portions are absorption, distribution, metabolism, and excretion. So absorption is one of the important section, and we will today see different factors that are associated with drug absorption. Now, what is absorption? Absorption is basically movement of a drug from where? From site of administration into the systemic circulations. So you are introducing a drug, and that drug reaches to the systemic circulation. That moment is absorption. Now, which are the different factors that affects the drug absorptions? Let's first talk about aqueous solubility. So if the solution is watery, then absorption is bit faster, okay, than comparison to solid form. So if we are giving a drug in a aqueous form, then absorption would be faster than in tablet form. So that is easily understandable. So the formulation is the important. So important thing is formulations. Formulations means in which form we are introducing a drug. So if we are introducing in liquid form or aqueous form, the absorption would be fast. Second thing, the concentrations. If we are introducing higher concentration, so obviously absorption would be faster, because we have already seen in drug transport system that mostly the absorption is passive diffusion, where drugs get transport from higher concentration to the lower concentrations. Area of absorbing surface. So obviously the larger area of absorption, the amount of absorption or the rate of absorption would be more. So intestines having a larger surface, so their absorption rate is higher in intestine. Vascularity of absorbing surface. More the vascular area, more the rate of absorption. So vascularity also affects the absorption rate. One of the important determinants of absorption is route of administration, through which route we are administering a drug. So if we talk about oral route, let's talk about oral route of drug absorptions. And we have already seen in absorption topic that acidic drugs are more absorbed from stomach, and we know the logic that if the drug and the medium is both the same, then drug becomes unionized, and unionized drug absorbs better. The same way, basic drugs are absorbed from intestine because the drug is basic and the atmosphere is also basic. So drug would be more unionized, and unionized drugs absorbs faster. Faster the gastric emptying, because gastric surface is bit less, intestinal surface is more. So fast gastric emptying, the more drug would go into the intestine and the rate of absorption would be faster. Particle size. If we are introducing drug in a smaller particle, for say in powder form or the liquid form, the rate of absorption would be faster. Presence of food. There is an important factor. Food presence in the stomach or in the intestine affects the rate of absorption, because it dilutes the drug and absorption rate would be lesser. So in most of the cases, food alters the absorption. If there is food there in the stomach or the intestine, it really affects or alters the absorptions, actually decreases the absorption of that drug. But there are some exceptions. Some drugs gets absorbed better with food. For an example, lumefantrine, which is being used in malaria. So absorption increases with fatty food. So there are certain drugs whose absorption gets increased with some fatty foods. Otherwise, most of the drugs absorptions with food get decreased. So that is why prescribers always give you advice to have a gap of around 1 to 2 hours of taking food and a drug. So they might say you take a drug after food, but after food means not immediately after the food, after an hour or 45 minutes of taking the food. So food affects the drug absorption. Another important thing is the HCl content in the stomach. We already know that severe acidic atmosphere is there, and this acidic atmosphere sometimes is very dangerous for drugs as well, because some of the drug gets destroyed through this acid. For an example, penicillin G, insulin. These drugs are not effective orally, and that is why these drugs, if you give orally, they will get destroyed by the acids. So they should not be given orally. So to prevent the destruction of this drug through acid, we are making enteric coated tablet. Means we are coating a drug with a membrane which is resistant to HCl. So HCl cannot, destroy the drug, and that is why we are coating a drug with membrane. These are called as enteric coated tablets, so they can withstand the acidity of intestine. Another formulation, if you'll see, that is sustained release preparation. Most of the brand names, if we see, they are having and with SR tablets. SR tablet. Now what is SR? SR means sustained release. Means what happens? This drug gets release its content gradually over the period of time. So these SR tablets, for an example, it's having different layers. Yeah. So after 1 hour this layer gets released, after 1 hour this layer gets released, after 1 hour layer gets released. So eventually this layer gets released and drug gets into the circulations or into the system, so drugs can remain into the system for longer period of time. So it increases the duration of action. So duration of action of that particular drug increases. So patient need not to take drug for more time. For an example, if you need to take some drug 3 times a day, then if you take these SR preparations, you need to take only 1 times a day. So patient compliance will increase. So this is how sustained release preparations will help, and most of these drugs now available are SR preparations. So the consumption frequency decreases and patient compliance increases. One more factor that affects in this absorption is P-glycoprotein, PGP we call it as P-glycoprotein. Now what are these P-glycoproteins? P-glycoproteins are called as special pumps. These are special pumps. What is the role of these pumps? For an example, this drug that is called as vincristine is gets absorbed into the cell. But what these pumps will do, this pump will, push out that drug out of the cell. So actually this drug goes inside the cells by themselves, but because of these pumps, they releases the drug, and because of that, the action of that drug cannot be accomplished. So these pumps are there into the gastrointestinal tracts, and these pumps are good as well as bad. Good in a way that it sometimes prevents the action of some of the toxins, and bad in a way sometimes they decreases the effect of drugs. So it's having both of the actions. So depending upon the situations, we need to give stimulators or inhibitors of these pumps. So depending upon the situations or target we want to achieve, we need to give inhibitor of these pumps or inducer of these pumps. There are few drugs which inhibits the pump, and there are few drugs which induces the pump. So I hope you understand what P-glycoprotein is in short. Another thing is drug-drug interactions. We already know that if you take 2 drugs or 3 drugs simultaneously, there are chances of drug interactions, and it is correct. And that is why it is better to have some gap between intake of those drugs. In gastrointestinal tract, one more important thing which has been going on, that is enterohepatic circulations. Now what is this enterohepatic circulations? Few drugs goes into the gastrointestinal tract. From gastrointestinal tract, it gets absorbed through portal circulation to the liver. Now from the liver, these drugs again gets released into the gastrointestinal tract. From this gastrointestinal tract, again few fraction gets absorbed into the portal circulation. Again few fraction gets released, again gets into the tract. So you know the cycle which has been going on from gastrointestinal tract to the liver to the gastrointestinal tract. So this whole cycle is called as enterohepatic circulation. And few drug undergoes this enterohepatic circulations, like for an example OC pills, you know, erythromycins, like few of the drugs which undergoes these enterohepatic circulations. And because of these enterohepatic circulations, they remain in a body for longer time. So remain in a body for longer time, so their action gets lengthened because of this enterohepatic circulation. Otherwise what happens, normally drug gets absorbed into the liver from the liver it gets into the systemic circulation, metabolized and eliminations. So normally this process is going on, but because of this enterohepatic circulations remains in the body for longer time. Now, if another drug affects this enterohepatic circulation, then it will affect the concentration of these drugs as well. So there are chances of drug interactions, and there are chances of interactions with gut flora, because gut flora takes an important role in this enterohepatic circulation. So if you alter this gut flora, there are chances of alterations of enterohepatic circulations, because gut flora, the normal bacterium of GI tract, are important for this enterohepatic circulation. So if you alter this gut flora, for an example, if you give antibiotics, and these antibiotics will alter this gastrointestinal flora, and it will affect enterohepatic circulation, and it will eventually affect the drugs which undergoes the enterohepatic circulation and their duration of action. So this is how enterohepatic circulation in brief get affected by different drugs and by GI flora. That was all about oral route. We are also giving drugs with other route as well. These are parent drug, we already seen, and these are subcutaneous and intramuscular. So now we will see which are factors of absorptions, or which are the important points affected with the absorption from this subcutaneous and intramuscular route. Intravenous, there is no issue because we are directly giving the drug into the systemic circulations, but we are giving drug into the subcutaneous tissue. From this subcutaneous tissue, drug gets into the systemic circulation. We are giving drug into the intramuscular tissues in muscles. From muscles it gets absorbed. So there are chances of other factors interfering in it as well. So let's see, absorption from subcutaneous site is lower than the intramuscular site, because subcutaneous site contains fat. So that fat interferes with absorption, so obviously it would be slower than the IM site. But both are generally fast and more consistent than oral. So if you compare these routes with oral, these are better route. So for an example, if patient is having an emergency condition and if you want to give a drug, which route you'll prefer? Will you prefer oral route, or you'll prefer subcutaneous or intramuscular? I will definitely prefer subcutaneous and intramuscular, because here the factor affecting would be less and there are more absorption of drug. Application of heat and exercise. If you give a drug intramuscularly or subcutaneously, and now if you apply the heat, it will increase the blood flow and it will increase the chance of faster absorptions. What if we give vasoconstrictor with this intramuscular subcutaneous route? If you give vasoconstrictor, the drug will remain there for longer time. It won't go into the systemic circulations. So action will be increased. So it will retard the absorption, action will be increased. And that is why with local anesthetics, we are giving adrenaline. So adrenaline is given with local anesthetic because local anesthetics action will increase and there will be lesser absorption of this adrenaline and less toxicity. What if we give drugs like hyaluronidase, which destroys the tissue around? So if we give hyaluronidase, which destroys the tissue around the injection site, it will increase the absorptions. So there are different ways of increasing and decreasing absorption depending upon the target we want to achieve. If we give vasoconstrictor, absorption will decrease. If we give hyaluronidase like drugs, absorption will increase. If we give heat and muscle exercise, absorption will increase. And obviously this route is better than oral in the for achievement of better concentration. There is also other side through which we apply the drug. For an example, we apply drug on skin in the form of cream, ointment, powders. We apply in cornea, we apply eye drops. We apply drugs on mucous membranes. What happens if we apply them? Let's see. There are chances of systemic absorption for topical applications. So like for an example, if we have applied a cream on a skin, will that cream gets absorbed into the systemic circulation? Yes, it's a little, but yes, there are chances of systemic absorptions. And if the drug is more lipid soluble, the absorption would be more. And taking that advantage, we have created transdermal patches. And I hope we have already understood what transdermal patches are. It has been already covered in route of drug administration. We apply those patches on the skin, and through the skin, drugs gradually get released into the systemic circulations and remains there for a longer time. If we apply steroid creams on skin, there are chances that these steroids gets into the systemic circulations, and there are chances of side effects as well, right? If especially if we apply those creams on abraded surface, if the surface has been already abraded, more chances of systemic side effects. For an example, some farmers, they get exposed to some of the organophosphorus poisoning. They spraying those organophosphorus poisoning and chemicals on the plants, and because their skin gets into the contact with those chemicals, there are chances of gradual absorptions, and it damages their nerves and skin. So these are the different factors that affects the absorption through topical site. We apply some drugs in cornea, for an example eye drops. Will they get into the systemic circulation? It will create the local effect, but there are chances it will go into the systemic circulation as well and produces systemic side effects. The example is timolol. This timolol gets absorbed through nasolacrimal duct. Nasolacrimal duct we already know, this is eye, this is nose. So here is the nasolacrimal duct, and this nasolacrimal duct gets absorbed the drug into the systemic circulations, and there are chances of side effects. We apply some drugs on mucous membrane, and it can also produce side effects. For an example, estrogen. If we apply estrogen vaginally, so there are chances of gynecomastia in male partner if she is sexually active. So this drug gets absorbed through the vagina, through the sexual contact into the male, and in male it produces gynecomastia. So there are chances of systemic exposure. That in short nutshell is, if you give drug topically, don't underestimate that drug only acts locally. There are chances that some of the drug gets absorbed and produces side effects systemically as well. So thank you very much. This was all about the factors affecting absorption.